Arthroscopic sternoclavicular joint discectomy. This patient has a degenerate disc tear on the right hand side, and the scope has been inserted into the sternal side of the joint. We can just see the inferior and posterior part of the capsule, the relatively well preserved articular surface on the sternal side. We're now just getting a glimpse of the torn disc. A spinal needle is introduced to establish the superior portal. A probe is then brought into the joint and the free edge of the disc pulled back. The shaver is then used to clear away most of the debris and tissue to more clearly expose the free edge of the disc. The disc can now be seen more clearly. Initially, the central bulk of the disc is excised using a punch introduced from the superior portal. The disc material is excised piecemeal. Access is difficult with a punch to the superior part and particularly the anterior edge of the disc. To access the superior and anterior part of the disc, a 90-degree radiofrequency probe is a useful instrument. We can see here the superior part of the disc being ablated, and when the probe is turned back on itself, it very nicely addresses the anterior part of the disc material. The probe is able to ablate the disc back to a stable rim. At the end of the procedure, we can now see the exposed medial end of the clavicle and articular cartilage. The free edge of the superior and anterior part of the disc can be seen and has been resected back to a stable rim. Passing the scope inferiorly, we can look at the inferior recess of the joint and see that there is very little disc material left. Rotating the scope medially, we can now see the relatively well preserved articular cartilage on the sternal side and the posterior capsule. We now move on to an acute left-sided SCJ disc tear in a different patient. The disc material is less degenerate and there's a complex central tear. A punch is used from the superior portal to remove the central part of the disc tissue piecemeal. A shaver is then brought in to reset this back to a stable rim. At the end of the procedure, a radiofrequency probe is used to excise the final remnants of the rim and establish hemostasis. The disc has been removed in its entirety and the articular surfaces are better preserved.